Hello everyone, good morning, good afternoon, and good evening. I'm Susan and I welcome you back to my channel. How have you been? Thank you for liking, thank you for subscribing, thank you for watching my videos, and thank you for sharing. Thanks for your comments as well. I welcome you once again. How have you been? How has been your week? Today is a Friday. Hope you're doing great. How is everyone? Hope you've managed to go through the week happily and all is going on well. So today we are going to talk about something that affects most women, and this is none other than the painful periods. So just get ready to join the board and we'll go over with this discussion of today. So today I looked at this specific topic because so many people are going through painful periods, and some think it's normal, others think maybe if you don't have painful periods then it's not worth. But I just want to discuss this with my sisters and brothers as well, because we are all concerned about this. It could be your wife, it could be your girlfriend, it could be your sister. So that's why even for the men it's important to know about this. So painful periods, right? Periods are meant to have that little bit of pain, or I can't say some pain, some discomfort, or some cramping. But then if it goes beyond, like me say someone has a lot of pain that it can even cause you to maybe skip work or school or your daily chores, then this is not normal. We know that periods come in when the endometrium sheds if there wasn't fertilization of the egg that was received after ovulation. So if this doesn't happen, then of course the lining or the endometrium will have to shed so that another cycle will be on its way soon. So what happens? Why do we feel that cramping or that pain? That happens because of the prostaglandins. These are hormone-like substances, or I can't say they are secreted by the body. They are like hormones, I can't say. So they come in and help the uterus to contract, the uterine walls to contract. So as they contract and expel the endometrium and all that which goes along with it, that's how you get to feel the pain or the cramping or the discomfort. But it shouldn't be very painful. It should be mild. There should be that slight pain or discomfort. But if it's really too much, then there is a problem, especially if you cannot do your other work or anything. So it means there is a problem. It's not normal uterine contraction pain. It's beyond it. So we get to see that the basic cause of this great pain, if you have lots of prostaglandins, if you have a lot of them, so they will cause very strong contraction of the stomach, of the uterine walls. And if there is very strong contraction, that means the blood vessels, some blood vessels will be compressed, and when they are compressed, there will be a cut-off of oxygen supply to the muscle tissue. So the muscle tissue being supplied by those veins will have no oxygen, and that will cause you the pain. So if the contraction is too strong, then the pain will become also too strong, because there will be insufficient supply of oxygen or total cut-off of oxygen supply to that muscle tissue at that specific area. So we have two kinds of painful periods, or we call it in the medical term. The medical term for painful periods is dysmenorrhea. So we have two kinds of dysmenorrhea. One of them is primary, then the other is secondary. So the primary dysmenorrhea is whereby you have this the pain. You have the pain before the periods and during the periods. That's all. So it just occurs a few days too, and even during the periods. So that is primary dysmenorrhea. But then if you have what we call secondary dysmenorrhea, it means that you'll have a disorder. There will be an underlying disorder of the reproductive system which is causing this pain. So there is already a disorder within your reproductive system. That's why you have this secondary dysmenorrhea. And the pain for this is really worse. It can start before the period. then it worsens during the period, and then even after the period it still continues. So that's how severe it is. So before, during, it's severe, and even after it continues, it doesn't stop. Most times it doesn't even respond to painkillers. So like maybe NSAIDs, non-steroidal anti-inflammatories, it doesn't respond. Like ibuprofen, it will not respond to it. Ibuprofen, diclofenac, it may not respond. Even when you take, you will not feel the effect. So that is mostly the secondary dysmenorrhea. So we see that the pain may start 1 or 2 days before for the normal periods. But for this secondary dysmenorrhea, it will start maybe like even a week. It will start forward long. So basically, for normal periods, we have you'll have like mild pain. Some people may have some nausea, some may have some vomiting, some may have some fatigue. So each one has a different way of experiencing this period situation. Some of them have like you may have like fatigue, a lot of it. But when we look at dysmenorrhea, the primary and the secondary, the primary, it will be short-lived pain just during that time, and you take the painkillers, it will cease. But the secondary, it may be severe because there is an underlying condition that is causing it. So even if you take these painkillers, chances are high they may not work, because these painkillers like ibuprofen, they help to block the production of the prostaglandins, which are responsible for the contraction of the stomach, of the uterine walls, so that you're able to expel the menstrual blood or tissue and everything. So I want to look at the causes. What can cause secondary dysmenorrhea? Secondary dysmenorrhea, as I've already told you, it's caused by a reproductive disorder. You already have a disorder in your reproductive system, and that's what will cause the dysmenorrhea. So what are the causes? We have several causes, but one of them can be endometriosis. Endometriosis is a condition whereby this endometrial lining, the lining of the uterus, it's found in other places of the body, maybe in the abdominal cavity or in the rectum or anywhere. So once this tissue is found outside the uterus during the times of the period, this tissue will also bleed. But because it has no way of expelling this blood, you will have that pain. So there will be pain, there will be swelling, and some people get like a scarring. So it's really very painful. So that is one of the causes, endometriosis. Then the other one is PIDs, pelvic inflammatory disease. If you have a pelvic inflammatory disease, this is basically an infection in the uterus. It can spread to other areas as well of the reproductive system. So majorly, you'll have these complications like too much bleeding, pain in the lower abdomen. So you'll have a lot of discomfort, and sometimes you'll have like spotting. So it has to be treated because it's caused by a bacteria. So it has to be treated with antibiotics, and then you can get well after it. But this can also be a cause for the secondary dysmenorrhea. We also have cervical stenosis. If the cervix gets tight or it gets smaller, so that means it will be very hard for this uterine blood, for this menstrual blood to be pushed out. So there will be a lot of pressure that the uterus will use, and this will cause you a lot of pain as well. Then we have cysts as well. We have ovarian cysts. These are fluid-filled sacs on the ovary, because this is where the egg is before it's released. So if maybe the egg is released, but this membrane continues to retain the fluid in it, and it keeps to grow and grow and grow, then it will be a cyst. So we call it a cyst. So even these ones, they cause this secondary dysmenorrhea. Then we also have fibroids. We know fibroids, these are like, we call them sometimes benign tumors or myomas. So if someone has fibroids, this will also cause this too much pain during the menstrual cycle, because it's something abnormal within the reproductive system. They are mostly found in the walls of the uterus. So Some of them are really big, some are very small, some are very big to the size of a melon. So even these can cause someone secondary dysmenorrhea. Then we have adenomyosis. Adenomyosis, this is a condition whereby the lining of the uterus grows into a mass. We get a muscle. There is a muscle tissue that grows within the lining of the uterus. So you get to have too much pain. So this makes the uterus much bigger. So it becomes much bigger and even abnormal, and the bleeding will become more severe because this condition is not the normal way of operation of the body. So when you basically look at someone with a dysmenorrhea or painful periods, because you can say, how can I judge that this is painful period or this is not a painful period? If your pain can make you unable to perform your daily tasks, let me say you can't go to school, you can't go to work, you can't perform your daily chores at home, then that is not normal menstrual pain. And even if you take painkillers, still there is no relief, then still it's not normal menstrual pain. So this dysmenorrhea, it basically, the secondary dysmenorrhea, it basically starts around 20s, the early 20s or early 30s. That's when you start to feel it. But previously, you didn't have these painful periods, but out of the blue, it starts to happen, like you're 20, in early 20s or early 30s, and you start feeling this too much pain during your menstrual cycle, during your menstruation. So, but before you didn't have it, so that means there is something wrong. And also you will get to see that your flow will be too much. Maybe you had mild flow last time, the previous times, but now it's getting so much. There is too much flow. So that could also be a sign for secondary dysmenorrhea. Then also the periods could be irregular. You could have them this time, then the other time you don't have them, or you could have just sudden spotting out of the blue. You're having periods, yet you're not supposed to have them. So that's also another sign. So you also have little or no response to the non-inflammatory, non-steroidal anti-inflammatories. So if you get this, like when you take ibuprofen, you don't feel any effect, it doesn't suppress the pain, or if you take the diclofenac, you don't feel any difference, then that means this is secondary dysmenorrhea. There is something behind your pain. Then at times there is also infertility. So someone fails to conceive but has this pain as well. So this is also another sign. There is also pain during coitus. If someone has that pain, some of them even get the bleeding after coitus. That is also another sign. Then also funny vaginal discharge could also be another sign or symptom. Then severe back pain. Some people get very, very severe back pain, which is too much that sometimes you can even not walk. So that is also another sign. Right, there is that back pain, lower back pain during the menstrual flow, during menstruation. But if it gets too severe that this is not really normal, you just get to know that there could be a problem within your body. Then at times this pain also goes down towards the buttocks or even to the legs or thighs. So that is also another indication. And also there could be pain in the rectum. Like if you go to pass stool, you have this very bad pain in the back, at the coccyx, near the rectum down there, when you have too much pain as well, especially if you're passing stool. So but this wasn't the case before, so that is also another indication. So basically I've just tried to talk about the painful periods. We have the two classes, the primary and the secondary. Primary is just a little pain, that pain before the period and then maybe during, but it doesn't go on. But for secondary, it starts before, even during the periods it's worse, and even after the period it persists. Just know there is a problem, so you need to go check out with the doctor. You have some tests done, and they can do some checkup and get to see what the cause is. The earlier the better. So in the next video I'll be talking about the management of this pain and what can be done. So that has been it. Thank you very much. Have a lovely afternoon, have a lovely morning, have a lovely evening from wherever you are. Have a good time. God bless you. Bye bye.